Yes, welcome back to our topic number 4, which is also our last topic on this module 1. What increases the risk of suicide? Let's get started. What increases the risk of suicide? There are usually no single reason for someone to decide to take their own life. Several factors can increase the risk of suicide, like having a mental health disorder. But more than half trusted source of all people who have died by suicide don't have a known mental illness at the time of their death. Simply means depression is the top mental health risk factor, but others include bipolar disorder, schizophrenia, anxiety disorder, and personality disorders. Aside from the mental health conditions, there are other factors that can easily increase the risk of suicide or committing suicide, which are incapacitation, poor job security or low level of job satisfaction, history of being abused or witnesses continuous abuse, being diagnosed with a serious medical condition like a cancer or HIV, being socially isolated or victim of bullying or harassment, substance use disorder, childhood abuse or trauma, family history of suicide, previous suicide attempts. Those are the factors that can increase the risk of suicide. Also, having a chronic disease, social loss of significant relationship, loss of a job, access to legal means including firearms or drugs, being exposed to suicide, difficulty seeking help or support, lack of access to mental health or substance use treatment, following belief systems that accept suicide as a solution to personal problems. Those who have been shown to be a high risk of suicide are men, people over the age of 45. Can you see now that those who are showing these signs are the higher risk of committing suicide? They are men and they are people over the age of 45. How do we treat people with this suicide thought? Treatment will depend on the underlying cause of the someone's suicidal thought or behavior. In many cases, though, treatment consists of talk therapy and medication. What do you mean by talk therapy and medication? Talk therapy, also known as psychotherapy, is one possible treatment method for lowering your risk of attempting suicide, because they have to speak to your cognitive, to your brain. We call it a cognitive behavioral therapy, CBT. It's a form of talk therapy that often used for people who are having thoughts of suicide. Ability to talk in a certain way to let you change the way you think about a certain aspect of your life. The purpose is to teach you how to work through stressful life events and emotions that may be contributing to your suicidal thoughts and behavior. CBT can also help you replace negative beliefs with positive ones and regain a sense of satisfaction and controlling your life. Those people, they are professional CBT. When they talk to you, you feel like changing your behavioral thoughts about a certain things or a certain aspect of your life. A similar technique called dialectical behavioral therapy may also be used. Then, if the psychotherapy cannot take it, if we talk therapy isn't not enough, successfully, then the medication may be prescribed to ease the symptoms, such as the depression and anxiety. So treating these symptoms can help reduce or totally eliminate the suicidal thoughts. So one or more of the following type of medication could be prescribed, like antidepressants, or antipsychotic medications or anti-anxiety medications. Lifestyle changes. In addition to the talk therapy and the medication, suicide risk can sometimes be reduced by simply adopting a certain healthy habit, which includes avoiding alcohol and drugs. Just try to stay away from alcohol and drug is critical, as these substances can lower inhibition and may increase the risk of you committing suicide. Exercising regularly. Exercising at least 3 times per week, especially outdoor, and the moderate sunlight can also assist. Sleeping well is also important to get enough quality sleep. Poor sleep can make many mental health symptoms much worse. Talk to your health care provider if you're having any trouble in sleeping. So this takes us to the end of topic number 4, which is also the end of module number 1. So please, in this page, you will see your assignment number 1 and your continuous assessment number 1. You can start working on this as we are preparing for the second module. Thank you and see you again in module 2.